Hello everyone, welcome back to my channel Learn in Minutes, and today let's know a little about tooth brushing. We will discuss many frequently asked questions such as why do we need to brush? What is the correct method of brushing? How often do we need to brush? Which type of toothbrush is the best? Which toothpaste is the best? Any additional dental aids that you can use? And finally, we will conclude with a few tips for maintaining good oral hygiene. So, why do we need to brush? Just like most parts of our body, if we don't maintain the health of our gums and teeth, they'll eventually break down. Saliva is the main defense system of the teeth and gums. However, saliva alone can't wash away all the bacteria, and this is where a correct brushing method comes into play. It helps remove plaque, which is a sticky, harmful film of bacteria that grows on your teeth, causes cavities, gum disease, and eventually tooth loss if it is not controlled. Next, let's see what is the correct method of brushing. You need to take a clean toothbrush, place it at a 45-degree angle to the gums, gently move the brush back and forth in short, tooth-wide strokes, always in a vertical direction and never scrub horizontally. Brush the outer surfaces, inner surfaces, and all the chewing surfaces of the teeth. Now, it is recommended to look into the mirror while brushing for obvious reasons like to know if you're brushing properly or not, to see and effectively clean any hidden debris. You can immediately compare the pre and the post brushing status of your teeth, which also acts as a motivating factor. Also, this is the best and rather the only time we bother to check our oral cavity. So go ahead, peek into your mouth properly, check if everything is fine and clean. And before you wrap up, remember, clean and wash your brush and keep it in a brush cap if possible. Next, how often do we need to brush? Long-term experimental studies show that brushing and interdental cleaning once daily prevents gum disease, but majority of the individuals are usually unable to remove dental plaque completely and thoroughly. Therefore, a general recommendation to brush twice daily is acceptable. Also, the estimated time spent by an adult on brushing is just 30 to 60 seconds, and that's not enough. The recommended duration for brushing is about 2 minutes, so try to keep this in mind and brush efficiently. Next, which type of brush is the best? Try to choose a soft to medium nylon bristle brush. Check for the bristle design. Bristles are usually either flat, zigzag, or crisscross. Now, all three designs are effective in removing plaque, but it has been shown that crisscross bristles exhibit maximum plaque reduction. Also, check for the bristle tips, as the bristles with a rounded tip have less destructive effect on teeth. Try to choose a brush that you can grasp properly, and additionally try to choose one that has a tongue cleaner or a roughened area behind the head of the brush, so that you can clean your tongue on a daily basis along with brushing, as 90% of cases of bad breath or halitosis actually originate in the mouth, mainly due to coatings of the tongue. And finally, remember that it is recommended to replace your brush once in 3 months or when it shows signs of matting, regardless of how long it was used. So next is the most common and the favorite questions of most of the patients, which is the best toothpaste. You must always keep in mind that it is actually the correct brushing action that works to remove the plaque on teeth. Almost all toothpaste share common ingredients. The truth is that it rarely matters what brand of toothpaste you buy. What is important is if the toothpaste you're using contains a recommended dose of fluoride, that is 1000 parts per million, that helps protect teeth against decay. Apart from this, check for the presence of certain agents such as detergents. Examples are sodium lauryl sulfate, which works to loosen the plaque from the surface of your tooth and creates a foaming action of the toothpaste. And finally, check for a mild abrasive, usually chalk or silica, which work to clean and also polish the teeth. Nevertheless, you need to make sure that the toothpaste brand you're using bears the seal of approval of an esteemed organization such as the IDA or ADA, for example. Now, this seal is a proof that the product has been tested properly for safety as well as efficacy. However, if your teeth are sensitive to hot or cold, you may want to use specific brands of toothpaste designed for sensitive teeth. These toothpastes contain either strontium chloride or potassium nitrate as their active ingredient. These desensitize your teeth by blocking the tubes in the teeth connected to nerves, providing necessary protection to any exposed dentine. An important reminder about the amount of toothpaste we use. Contrary to the popular belief, you do not need to put a lot of gel or paste on your toothbrush for it to be effective. In fact, a pea sized dab of toothpaste on the top half of your toothbrush is more than sufficient for an effective brushing. Next is a small note on additional dental aids that you can use apart from the toothbrush. Depending on the type of contact that is present in between your teeth, various aids can be used, such as a floss that can be used in the cases where teeth have tight contacts or you see crowding. Interdental brush can be used when the gap between your teeth is wide or if you have braces. Apart from this, oral irrigators such as water pick can also be used, which is designed to remove plaque and soft debris through mechanical action of a jet stream of water. So let's conclude with a few tips to maintain good oral hygiene. First and most important one, we all know we need to brush twice daily. Try to floss at least once daily. Rinse your mouth with water after every meal or even a snack break. Avoid sticky snacks, processed fruit, aerated drinks. Include a lot of fibrous fruits and vegetables in your diet on a daily basis. And drink plenty of water. And lastly, always wear your beautiful smile. Thank you.